Today we are going to talk about maxillary first molar infection and odontogenic maxillary sinusitis. Some of you must wonder how maxillary first molar infection is related to sinusitis. In order to answer that question, we have to know the anatomy of maxillary first molar and its adjacent structure. Our teeth are sitting on two bones, maxilla and mandible. The green bone in the figure is maxilla. Because the upper teeth sit on maxilla, we also call them maxillary teeth. Among one side of the upper permanent teeth, there are two incisors, one canine, two premolars, and three molars. The teeth circled in red are left and right maxillary first molar. After knowing where maxillary first molars are, we should turn into a smaller scale to see the structure inside a tooth. We can divide the tooth into crown and root. The crown is the visible part of the tooth, and the root varies in side bone and gingiva. The outermost layer of the crown is enamel. It is the highest mineralized tissue in our body. Beneath the enamel, there's a less mineralized tissue called dentine. It also appears in root. At the core region of the tooth, there's a hollow space containing pulp, which consists of soft tissue, blood vessels, and nerves. The space near the crown is much bigger. We call that segment pulp chamber. When the space extends to the root, it becomes narrower. We call it root canal. At the tip of root canal, a small opening called apical foramen connects the interior tissue to the outside. If there's a serious caries, the bacteria may move through enamel, dentine, pulp chamber, and all the way down to root canal. What's more seriously is that if the bacteria break through apical foramen, it may cause infection and even destruction of the underlying bone. Do you still remember the bone maxilla? Yes, it is the bone that upper teeth sit on. Actually, inside maxilla, there's a hollow space called maxillary sinus. It is one of the paranasal sinuses, and it is where sinusitis may occur. This is maxillary first molar, and that is maxillary sinus. Between the root of maxillary first molar and maxillary sinus is just a thin layer of bone. Therefore, if not managed properly, the infection of the tooth may have a chance spreading to maxillary sinus and cause sinusitis.
After introducing the anatomic structure of the maxillary first molar and maxillary sinus, we will next focus on how odontogenic infection occur. First of all, it has reported that odontogenic infection is caused by polymicrobial with a large percentage being primarily anaerobic infection. When the balance between oral bacteria broken, our mouths will become unhealthy. Secondly, when they are full of pathogenic bacteria, these microorganisms will cause necrosis in the dental pulp from deep caries. As long as the bacteria turn strong enough to destroy enamel and dentine, the pulp will be infected. And it will following become necrosis because of our body's immune system. Finally, when our pulp is absolutely necrosis, the pathogen will spread into adjacent bone and soft tissue. Let's look at the picture about infection pathway. When the pathogen spread into adjacent tissue from our posterior teeth, there will be some pathway happen. For example, it will be spread up into maxillary sinus. It may also have the ability to infect palate, buccal space, or vestibule in oral cavity. Today, we will pay more attention to the specific pathway about maxillary sinus. It's because that when maxillary sinus infection occur, the highest percentage is coming from maxillary first molar. To make our target to this tooth, the following presentation will be centered on maxillary sinusitis associated with maxillary first molar.
Before the 1970s, approximately 10 to 12% of maxillary sinusitis cases have been attributed to odontogenic infections. With technical progression and increased incidence of odontogenic maxillary sinusitis, so-called OMS, has been recorded over the last decades. A variety of odontogenic diseases involved in OMS. The most common cause is oral enterofistula, which is an inadvertent communication of oral cavity and maxillary sinus. Oral enterofistula can occur with or without tooth extraction. Periodontal diseases characterized with receded bones and gum and elongated teeth may also increase risk of OMS. Incorrectly positioned dental implants may protrude into the maxillary sinus, resulting in mucosal thickening and opacification with air bubbles in the right maxillary sinus. Alongside other dental alveolar lesions include retained tooth infections and impacted teeth. The molar region has highest frequency of involvement in OMS, followed by the first molar, the third molar, and the second molar. As for the premolar region, it only affects a minority of cases. This page shows a model of infection route from oral cavity to maxillary sinus. Firstly, dental diseases or inappropriate dental treatments cause the spread of bacteria directly into the sinus cavity, causing hypertrophic reactions. Infections may result in OMS and orbital infections such as infraorbital cellulitis and transient blindness in worst cases. Late diagnosis and treatment of this problem can lead to severe complications, such as cerebral abscesses and life-threatening cavernous sinus thrombosis.
When it comes to medical treatment, it's important to recognize the etiology and choose an appropriate treatment accordingly. Since the topic focuses on endodontic maxillary sinusitis, solving the endodontic infection is our primary goal, and the most common way to manage it is root canal treatment. Let's see how root canal treatment is done. Clinically, root canal treatment requires 5 steps. The preparation step includes checking dental X-rays results, giving a local anesthetic, and placing a dental dam in the patient's mouth. Next, with the assistance of dental instruments, dentist makes an opening on the crown to remove the infected pulp. After cleaning, the root canal will be shaped and enlarged. Later, a thermoplastic material named gutta percha will be filled into the root canal and fixed by the sealer. Last, if the tooth has undergone severe damage before the treatment, adding a crown on it is important. The crown could reinforce the strength and stability. And these are the 5 processes of root canal treatment. Most of endodontic treatment can be managed with root canal treatment. If not, here are other ways. For example, combined antibiotic use, apicoectomy, tooth extraction, and endodontic surgery. Root canal treatment helps preserve natural teeth and is a good way to manage endodontic infection. However, prevention is better than cure, and we suggest that taking care of one's oral health on a daily basis is the best treatment.
Now I'm going to share a clinical case relating to right maxillary molars as an evidence of the contents aforementioned. The case is cited from effects of endodontic infections on maxillary sinus, a case series of treatment outcome in Journal of Endodontics. The patient had a chief complaint of intraoral swelling, pain in the area of the maxillary right molars with difficulty in chewing and heaviness sensation when lowering her head. After clinical examination, a deep periodontal pocket of the second molar was found, while the first and third molar revealed pulp necrosis. As the combing CT image shows, the second molar had a large apical periodontitis lesion, the grayish appearance on the picture, extending to the maxillary sinus, which leads to severe bone loss at the floor of the sinus and buccal plate. The patient was diagnosed with apical periodontitis and odontogenic maxillary sinusitis. For the treatment, the second molar was extracted, while the first and third molar were treated endodontically. As you can see from the after-treatment image, the previous grayish appearance of the lesion site had turned black, meaning that the inflammation and obstruction had been eliminated. The bone restoration of the sinus floor can also be seen. Therefore, the 15-month follow-up revealed complete resolution of the sinus condition and repair of the periradicular tissues. Odontogenic infections are common causes for maxillary sinusitis, especially when the infections take place in the maxillary first molar, which is the closest tooth to the maxillary sinus anatomically. The infection can be triggered by numerous events, including periodontal disease, deep caries, and pulp necrosis, all of which are common dental issues clinically. Aside from maxillary sinusitis, systemic infections can be further induced if dental infections are left untreated. Tooth extraction, root canal treatment, and taking antibiotics if necessary are general treatment for odontogenic maxillary sinusitis. However, prevention is better than cure. We consider that taking good care of one's own teeth daily to be the best treatment. Here are our references. Thank you for watching.